Thanks to medical science, great progress has been made in tackling cancer's devastating toll. Patients' experiences of cancer have been transformed by new insights into cancer's basic mechanisms, improvements in screening and diagnosis, and the introduction of life-saving therapies. Progress is not just attributable to the unwavering work of scientists and doctors. It also requires dedicated public servants, leaders who raise awareness, provide funding, or seek to ensure that therapeutic advances benefit all who need them. People like Mary Lasker. When she began her advocacy work in the 1930s, the word cancer was only spoken in hushed tones. Patients often suffered in secrecy. Mary was infuriated by cancer's toll. As she put it, she was opposed to cancer in the way she was opposed to sin. She supported the work of scientists in their labs and lobbied government officials to expand U.S. federal funding for cancer research. In later years, as Mary campaigned for the U.S. National Cancer Act, she realized she needed to galvanize public support. She enlisted her friend Ann Landers, the widely read advice columnist. After Ann urged her readers to write to their congressional representatives and the president, an avalanche of mail inundated those leaders. The act was signed into law in 1971. Public awareness of cancer research is central to ensuring clinical breakthroughs are available to all. Lewis Thomas, the renowned essayist, secured public buy-in with his eloquent scientific writings. And the New York Times reached readers around the globe with its quality science coverage. Policymakers are essential too. They have created programs, channeled funding, and guided health legislation to passage. Philanthropists can make a real difference. Think of Nancy Brinker, who, with just $200 and a shoebox of potential donor names, started Komen, now the world's largest nonprofit for breast cancer, raising billions. And Christopher Reeve, whose personal adversity spurred him to work for support of spinal cord injury research. The fight against cancer isn't over until everyone has access to research advances. Lasker Laureate Harold Freeman knew this. Dr. Freeman set up practice in Harlem to bring the latest surgical techniques for breast cancer to that underserved community. But he quickly realized that his patients, mostly poor African American women, were presenting with disease too advanced for surgical intervention. So, he set up screening clinics and created an innovative patient navigator program, aiming to modify social determinants of health, including problems like inadequate insurance or a lack of transportation. Today, patient navigator programs are widely available, and there is greater recognition of the need to address social determinants to promote health equity. As our battle with cancer continues to unfold, we celebrate the advocates who refuse to accept the status quo and are willing to use their dedication, skills, and resources to break down barriers and push for progress.